Hello folks, I am Nikhil here from Mission Germany, and today joining us is Dr. Singh. He has come back from Germany and he has passed his FSP exam. He is working in Germany, he is employed in Germany. So just to give you a small history how the things all started, I happened to talk to Dr. Singh around 3 years back when COVID was in the last stages, and when I spoke to him for the first time, he is from Delhi. He said, "Sir, MBBS khatam ho gayi hai, and I am looking for opportunities where I can go abroad, and India is not a country he is interested in because he wasn't very comfortable with the system in India for his own personal reasons, and he wanted to be an orthopedic, and private was not an option for him because he was not very sure of the quality of training, and Sarkari mein there is so much of competition and reservations and all the things are very unpredictable." तो जब डॉक्टर साहब से मेरी पहली बार बात हुई थी तो मैंने डॉक्टर साहब को ये कहा था, मैंने सर आई हैव गॉट ए सोल्यूशन विद मी वेयर you can get a specialization of your choice. There is no competitive exam to go for it, and unlike India where you are investing money to be a specialist, there is a place where you will be paid money to be a specialist. They were quite surprised that is it really possible, and then I got him introduced to the German system and explained the entire process. So we started the journey around 3 years back. We got the languages done for doctor in India. Then during the last stages of COVID, he traveled to Germany. He furnished the other part of the process in Germany, and in the last 1 to 1.5 years time in Germany, he has gone through the FSP, has passed FSP, and he got a temporary license now. So I thought, I'm meeting him after a gap of around 2.5, 3 years now. Luckily he was in India, so I thought let me just take a small review from him, ki how was his journey like, what are the challenges faced. So Doctor sir, आप बताइए, means we are meeting after 3 years of time. So कैसी रही अपनी journey all the way for the last 3 years, and if you can tell to my students and all ki what all things you did and what you suggest them to do and what you have to avoid doing, they will get more motivation, what I am to say.
So my only suggestion is just focus on the language. Rest is not like your part. He will do everything for you. So best is focus on the language, like, and learn the language like in a practical way, so you have a better command, because when you learn the books you will not get, how to say, like, you will get a command but it's just for a bookish, but you in practical you need to learn how to speak some with the accent, because the accent problem what I had in starting was very difficult too, because I was speaking German but it was like Indian accent with it. So in starting I had some problems, but now it's okay. But I suggest better to learn in like the practical way.
Okay.
So this is the language part, and for the study part, like he will guide you throughout the process, like step 1, step 2, step 3, and you just need to be calm and follow what he says. It's always better because everybody have a question, like when I was doing it in 2 years back, I am asking, sir, tell me the procedure now, what should I do? Like, we can do our part, but we cannot do the medical council part and like the replies from embassies. I know, like, we get panic because my time was very different in COVID, like it was taking longer. Suppose he say 2 months, I was getting things in like 4 months.
4 months.
He cannot do that thing. He just can reply or write an email to someone, but the time for the reply we were getting like around almost 3 months, 4 months. They were all saying, please refrain to write, please refrain. Like this line, I was like, the best line I had in 2 years, please refrain. Always was like this.
Yeah.
So we cannot do that thing. So it was tough in starting, but then it was like nice when I was getting some replies, and I know. So I was enjoying my last time, was like, okay, I have just this time with my family and see. Then I will be working, so enjoy that part, not get panic. Oh, when I will go. This was the main thing.
And I will just try to make you understand how the entire system was executed for Dr. Sir. You see, when he connected, Dr. Singh connected with me, we started with the languages for Sir. While he was doing the languages in India and all, we started the documentation for him. And with the German Medical Council doctors, as they always tell to everyone, it takes around 7-8 months of paperwork. It's not that we invest 7-8 months to execute the paperwork. Germans take that much of time because there are so many multiple steps which have to be taken. So while we were learning the language, we were doing the paperwork, and then we applied for the visa with deficit and all to go to Germany. To our surprise, it took longer than usual to get the visa. So instead of 2.5 months, it took around 3.5 months for him to go. So the process got delayed and all, but never mind. When he went to Germany, he did the advanced part of the German language. He prepared himself for FSP. When he was preparing for all those things, parallelly we looking for jobs so that you are eligible to write the FSP exam only when you got a job offer letter. Your daughter were doing part-time jobs in Germany so they can improve your language skill sets. So at the end of it, we have to build up your profile. You have to be good linguistically in the language. We can guide you across so that you can apply to hospitals for the jobs, so that they call you for the interviews after assessing your profile and other things. But at the end of it, how you act and react during that interview is the thing which is purely in your hand, where I cannot be of any help to you, neither anybody can help you out. It's your own personality, your confidence, your clinical skill set, and most importantly, your efficiency in German language will get you through. So this is how the things go. He has really worked very hard, and we have gone through good phases, we have gone through bad phases where the things were not moving. But at the end of it, we have turned out to be winners. So I'll tell to every student, if you want to talk about German process, you cannot fail in the German process because there is no exam to fail. You just qualify the language, keep patience with you. Germans will be slow to react. Keep working, keep working. You may be late in Germany, but you will always reach the destination. So that is my say. And doctor, if you want to add something on it, you can always add.
Like I can add, you helped me in COVID time, like in the hospitation, because
Yes,
that
hospital,
time was very difficult.
Yes,
I was writing emails to hospitals.
Yes.
Only one sentence I was getting. In COVID time, we don't need any extra person in the hospital.
Right.
So
Yeah,
I wrote almost like 15 to, I think more than 15 or 50, I don't remember that time, but that time was like just copy, paste, write and send. Like, but thank God I got an offer,
right.
like in urology department, that was for 3 months. So
At present, where are you placed, sir, in Germany? I myself forgot.
Right now I'm in Aue.
Okay, right. Fine. In the eastern part of Germany. Any difference, doctor, between the eastern part and the western part?
I will suggest, like for paperwork and to settle down, east is better.
Okay.
But when you have your Cantonese proofing, like you pass the exam, move where you want. But I will suggest Bayern.
Bayern. Okay, Bayern is good once you get a license, not before you get a license.
Like you can, but it's better to go because Bayern is like a very good competition because everybody is applying to Bayern and NRW.
Okay.
It's good, but exam is like how to say, like it's overcrowded from the international students. I say.
Okay.
In East is like you don't have to wait that much for the exam.
Fine.
Like in 2 months you will get it. In NRW, people are waiting for 6 months, 8 months. Somebody getting after 1 month, somebody is waiting for a year. I don't.
Okay, so there's a lot of luck also comes into play.
Yeah.
Fine.
And it's also depend your unstretched partner who is responsible for you when you write an email, how they respond.
Right. So, doctor, this is all. There's nothing more to ask. But bottom line says you have to be patient and good. And for anything, always you can come back and let's see how the things go. Fine. It was nice connecting with all of you. And for anything, you can always reach me back. I'm Nikhil from Mission Germany signing off. And congratulations, doctors. We deserve a big treat from you. Fine. So, ciao, take care. And what you can tell in German to them?
Like you can say at least a buy in German.
Buy
like
in German. Choose. Yeah.
Not choose, like choose.
Choose. No, I don't know German, frankly speaking, man. So it was nice connecting with all of you. Bye. Take care. Bye.